I'm Joffrey Fowles. This is Emmett Fletcher and Bradley Wallow. We are members of the team Awesome for the process control project of HIV control. And we're doing a case study on a man named Jose Stalin. He came in with a virus count of 200, which is within the acceptable bounds for a healthy life. If the virus reaches a level of 744, then there isn't much more that we can do for him. And just because of accuracy as far as reading the virus and treating the virus, below the level of 20, there's a lot of uncertainty. So that's what we have as a set point for acceptable virus levels, is between 20 and 744. And so the point of this study is to determine how little antiviral we can give him and also keep him within those bounds. Keeping in mind that the antiviral medication, if given in a dose above 20,000, would have just as much harm as if we were to let the virus get to 744. It would kill him as well. So we kept below the bound of that while minimizing the amount that we could use. So,
for our model, we used a state space function to create our transfer function, which is given in the block diagram there. Something we decided would be necessary is to model how much antivirus would be absorbed into the bloodstream or how much would just be passed through the body. So we did a factor of 0.75, saying that 75% of it would just be passed through the body and not absorbed into the bloodstream. We figured that would be more realistic conditions. And as Joffrey said, we used a steady state value of 200 cells, and so we designed our model around that value. We then implemented our controller and tuned it using Simulink. And we wanted to see how our controller would compare to an optimization model. And so we optimized the model as well for a minimal amount of antiviral.
So our results were a little surprising. So on the graphs you see the virus is on the top and the antivirus is on the bottom, and the red line is our control model where we set a set point and let the controller control that, and the blue line is the optimizer where we optimize the minimum amount of antivirus given over the 10-year period. And you can see they're a little different, but after looking at it, we decided they're pretty much the same because of the simplicity of our model. Statistically speaking, they're close enough to be about the same. And as far as Jose goes, he is alive because the spike at the very beginning of the antivirus is at 12,000, which is below 20,000 of our acceptable limits, and the virus starts at 200 and shoots down to about 20, which is also within our acceptable limits. And the antivirus over the total 10-year period for the control model was about 20,000, and for the optimized model was about 19,000. And then we also did different set points. So we set a set point of 50 viruses, and that was over the 10-year period. Jose got 25,000 antivirus injected into him, and then at a 100 set point he got 34,000, and at 200 set point he got 55,000. So as you can see, as the virus level decreases, the set point of the virus, as that decreases, the total amount of antivirus over the 10-year period decreases. So Jose, we can keep him alive through this model.